What is autoimmune disease anyway? So the immune system, it's supposed to attack things like bacteria and viruses and things that are like foreign invaders. And sometimes we don't know all the different reasons why autoimmune disease happens, but we do know that the immune system can sometimes attack things that it shouldn't be attacking, like our own body, like our own tissue. So we saw this a lot when COVID happened, where the immune system got really ramped up and it started to attack things so fast and crazy, and it created such an inflammatory response that oftentimes it would trigger an attack on our own tissues. Now, also, there can be genetic factors, like if your mom has Hashimoto's and maybe you got Hashimoto's, or maybe you have a grandmother that had lupus, or maybe one of your cousins has multiple sclerosis or rheumatoid arthritis. So it can run in families. Autoimmune disease is 80% women, 20% men. So it can run down the female side. It can get triggered when you go through puberty or have a baby or go through menopause. That can be a trigger. Sometimes when you have a real bad toxic exposure, it can trigger. And it can also trigger if you get like an Epstein-Barr infection. It's anything that really gets your immune system like really revved up so that it becomes sort of overactive where it's attacking parts of our body. Now, also, if you have sensitivities to gluten and dairy, that can make it worse. There are ways to calm down your immune system to try to get things to settle so that the attack is less, bringing down the inflammation, trying to get your immune system to calm down. Vitamin D, glutathione. There's lots of things to talk about. I have a whole TikTok channel that's all about autoimmunity. If you want to know more, jump on some of my videos, ask some questions. I'm happy to make some really specific videos about this topic.